right, ladies, and actually even men, because it seems like women are not the only ones concerned about keeping up with their skin these days. Today's guest is popularly known on Instagram as the Nashville Beauty Girl, and she is responsible for many of the glowing faces walking around town. I really wanted to have an episode to kind of navigate through all the treatments and procedures you might have heard about. Social media will tell you a million different ways to address one concern, but how do we know what's right for us? Keri is here today to talk about her favorite things to do on her clients to keep them feeling their best. We talk about topicals, injectables, laser, and her specific recommendations to treat specific concerns like wrinkles, skin sagging, brown spots, and more. If you've ever thought you might like to try something but just feel overwhelmed by it all, I know you're going to find this episode helpful. These treatments might not be for everyone, but I really love how open Keri is and why she thinks that taking care of your skin is an investment in yourself. So without further ado, here's my conversation with the Nashville Beauty Girl, Keri Lea. Well, hello. Welcome to the podcast.
Thank you for having me.
I have Keri here today, fondly known to most of us as the Nashville Beauty Girl on Instagram, keeping all of us looking our best.
Yes.
I wanted to have you on today, and I was so glad you said you would come because I feel like every time I come to see you for a visit, I get a slew of questions afterwards, mostly being like, wait, what was that?
Yes.
What did you do? What did she do? How much does that cost? How long does it last for? Would that work for me? And I kind of feel like I always then will text you the questions and I'm like, what should I say about this? What should I say about this? So,
and you're not the only one.
I know.
I do appreciate it because I
Yes.
love the resourcefulness of the patient feedback. And then I'm like, wait, they want to learn.
They do.
I'll need to say more.
Yeah.
Yes.
Well, and I think too, so many people, it's like they want to know, but they're either worried they're going to get the wrong information.
Yeah.
They don't know where to look for the right information.
Sure.
They've had a bad experience
Sure.
or they've heard someone else say they have a bad
Sure.
experience or
They just don't know.
they don't know.
They don't even know.
And they don't live in Nashville, so they don't know who should they go to. And it's your face. So that's something that you obviously are looking to take care of. Okay, so before we start, will you just tell us a little bit about your background, kind of how you got into the skincare?
Yeah. So I'm a registered nurse. And honestly, I wanted to go to interior design school and never wanted to go to nursing school. But my mom was a nurse. My dad built airplanes, so I couldn't go to work with him. So I used to go work with my mom.
Okay.
And I think it was just like this, it's just what you do. Of course, this was over 20 years ago. And when I mentioned I want to go into interior design school, they didn't know what the hell to do with me.
Because that wasn't a huge thing.
It wasn't a thing, no. So I went to nursing school. And I remember even decorating my research boards with curtain material and making it pretty. So I feel like even looking back, growing up, I always was the girl that helped to get all my friends ready. Like if they were going on a date or, going to prom or whatever, they were like, okay, Keri, let's what's she going to do? Maybe she can help me do my hair.
Yeah.
And I also was the girl that used to vacuum my mom's rug and make perfect little lines. I got
so you have an eye for making things look good.
I always wanted to make things look better. Yeah. So looking back, I went to nursing school and I worked in the NICU. So looking back at that career, part two is that I was comfortable with needles in tedious areas, like in the baby veins. Yeah. I had a friend that started working with Allergan, which is a company that makes Botox. And this was back 2000, oh my gosh, 2, 3. So really Botox and fillers and all those things weren't even a thing yet because that didn't happen until 2004. And she started working with the company and said, hey, you worked at the Clinique counter all through nursing school. I know you love this stuff. I think I'm going to send you to Atlanta and you're going to get you trained and you're going to do Botox. I'm like, okay. So I took my mom and bruised the hell out of her.
Your mom was your patient?
That was my first patient. Yes. And so, but I realized back then that I was kind of comfortable with needles in small places. And I was a Wednesday Botox girl for a long time, some place out in Cool Springs. I don't remember the name. And I just, I basically manifested my whole career.
Wow, I did not know that.
Yeah. So let's see, like I said, this growing in this industry gave me, I feel like the niche that I have now to be able to explain to, patients what they need and all these different treatments. Cause I grew with the industry cause I was just a young.
You were like an OG Botox.
Exactly.
Yes.
Exactly. So yes, I was definitely an OG. Like growing up in the industry, of being one of the first people
So
injecting
how old were
Botox.
you at that point then?
I was 24.
Were you doing it on
24.
yourself at that time or no, other people?
I always did myself.
From that early age, you did?
Yes.
Okay.
Isn't that crazy?
Yeah.
And when I train other doctors and nurses to inject Botox as a trainer, and the trainees I train, the ones that actually do inject themselves, end up being the best injectors. So that is something that if they're always afraid of injecting themselves, oh, I couldn't do that, I can't do treatment on myself.
Yeah.
I'm like, they're not going to have it.
So you still inject yourself to this day?
Absolutely.
Does anyone else ever inject you?
Only Dr. Hightef when I can't get to where I need to go.
Okay.
Safely.
Wow. That could be
But
dangerous.
no.
I feel like if I could inject myself, it would be bad.
Yeah.
I feel like I would just be
Well, it's the
injecting all
experience.
day.
I think that I can see what muscles, and I can feel it, and I can see what muscles on me are, needed to be addressed. And I think it's just part of the way I learn.
Okay.
So yeah.
Well, I'm going to ask you all about Botox. I'm going to ask you about filler and injectables. But I want to start with, because one of the things I told you I really appreciated when I came to see you, and I've been to see a lot of other people, like for my skin, and all these people had all been great. But what I appreciated about coming to see you was on my very first visit, you asked me what it was I wanted to do. Like when I looked in the mirror, what did I see? And you did something called facial mapping. Is that right?
Facial mapping, yes.
Okay, so can
I
you
made
just
that
share?
up too.
Oh, you did? Okay.
No,
well,
I made
I
it
love
up.
it because you had like the paper out. You had a white crayon on your face. I mean, it was like a kind of architectural.
Yeah.
Project.
So no, yeah, I usually, when you come to see me and you're a new patient, I first ask, what's your hopes and dreams for this appointment? And then I feel like no one's really safe. Like no one's safe. Like, I'm literally always like on when I'm looking at someone's face. I'm looking at imbalances. So I can figure someone out within about 30 seconds of talking to them of what treatments.
Is there a common answer most people will give you when you say, what's your goal? Like, do most people just say to look younger, or are they more specific?
I honestly, that's a great question. Everybody wants just, I think, to feel and look their best.
Okay.
But they don't know how to say it.
Yeah.
So they definitely start pointing, or they'll talk about a bad experience they had. So it's one of the two. But when it comes down to it, they want to feel and look their best.
Okay. So facial mapping is you look at their face.
I tear you apart.
Yeah.
I just tear you apart.
You do. I mean, it wasn't mean. You weren't mean. You just were and here and here. And I was like, wow, this is a lot.
Well, here's the deal is that when there's so much bad work being done, and I feel like when a normal person is going into a provider, they are seeing the symptom. Like they're seeing like little things that are the symptom, but the disease is bigger than that. And so for me to explain the reason why they're seeing certain things, then that is the only way I can explain it, is to draw and to really explain like what, they're seeing and why. And then when that happens, I kind of start going into what treatments or what verbiage we would be using to get to that outcome.
Okay.
And so that's where
like if
facial mapping
I
comes
say,
in.
for example, came into you and say, I don't really know what the problem is. All I know is I'm starting to feel through my cheekbones, I'm starting to feel like my skin is sagging. And maybe I think, just from someone that doesn't know, maybe someone told me, well, you need a facelift.
Like, I have these lines.
Right. Or I might say my skin is sagging. I think I need a facelift. And you might say, well, you actually don't need a facelift. I can do something else that maybe I don't even know exists.
Yes.
Okay.
Well, there's also the combination approach of surgical and non-surgical, and that's probably the beauty that I've always worked as a plastic surgeon, and that was so huge to me, only because I had that support, because I believe that it's a combination approach of sometimes they're just hereditarily issues that you just, I'm not going to, is 30% result from non-surgical going to be good enough for you, or is it not? Because if someone walks in, they're like doing this the whole time, I know that we're probably going to have to like bring in Dr. Hightef to have a little conversation. Because just because you do a consult with plastic surgery doesn't mean you're getting it done. It's just gaining the knowledge.
So there's some things like skin sagging that you are not going to, you could help.
Yes,
but it's not.
I'm very careful with those words, because when you have someone that's dealing with acne scars and that frustration, and then you have someone dealing with just, maybe they've lost a lot of weight, or it's just their skin quality that it's frustrating. And they maybe have tried all kinds of other non-surgical treatments and didn't get the result they wanted. But those two things, you can never say the word, I can make this go away, or you don't need a facelift, or
do you think
whatever.
A lot of people have been burned by people who have told them
Absolutely.
Yeah.
Absolutely. Because you're giving someone so much false hope.
Yeah.
And those are really hand-holding type patients. The worst, not the worst, that's a big word. The most, I think, the hardest consults are the patients that have like scarring, because you have all the modalities to use to make it better, but more than likely you're not going to make it go away.
Okay. So there's not a single treatment that can 100% make a scar go away.
I don't think, no, absolutely not.
What can help it go away the most?
Heat and subcision. So subcision means that you are breaking up scar tissue to make the skin lay flatter. But then you have to go with other modalities to give like a surface appearance result, like peels, like things that cause downtime. Okay. And a lot of people don't want downtime.
So this is for like acne scars you're talking about? If someone has like
acne
acne scars?
Or scars from an accident, or just like texture, but mainly it's going to be the acne scar patients. Okay. Absolutely. So they've had to deal with a lot.
What treatment, like,
confidence.
Even though I know you're saying it couldn't 100% do it, but what machine or treatment would you use or say the best for acne scars?
I would say laser resurfacing, like a CO2 type based laser, because you're almost peeling the skin. Yeah. So you're going to make it look better, but you're also
the one where you're
heat.
Down for a long time and you look like you have like a burn victim patient?
Yeah, you got a little swelling, a little peeling there. So you got to definitely make sure that the patient's okay with that. But you can make it shout, talk, or whisper. Like I can make that laser do what I want it to do and do smaller treatments that are effective, but we just do more of them. Okay. And skin type matters too. You can't put a big laser like that on someone that's got darker skin type, because it'll hurt their skin. Okay. Then they're dealing with pigment issues. Okay. So you really have to be selective, and you have to like mentally make sure the patient is there with you, because it's hand holding. Okay. Those are big girl treatments.
Is that like a one and done treatment, or you need a series for scarring?
It's series. It's consistency, and that's also something I'm really big about, making sure that patient is like, look, you're gonna have my phone number. We got to be consistent. You got to book out. Like you can't just be doing like a micro needle or a peel and think that it's all going to be, unicorns after that. Like you are going to have to like really stick with me here, because you're going to get frustrated with me. Yeah. You're going to hate me. You'll love me again. But we're going to look back from a year from now and see a huge difference.
Yeah. You have said to me, you said, I'll expect your panic text from you later. But I do think as long as you say to somebody, me, you'll be fine. This is normal. You're going to be fine. Yes. You'll love it when it's done. Yes. Then I'm like, okay, fine. Yes. Okay. Yes. I look like I got in went 10 rounds.
Bruising is the other thing. Bruising is when you're dealing with a lot of the non-surgical methods that I use, which are with needles and, things that I have downtime with, then bruising is probably like the number one, like annoyance. Yeah. So I'm very, very upfront, especially with my females, about bruising. Yeah.
And I think some people bruise more than others, right?
Absolutely.
Like me.
Absolutely. Absolutely.
I think I bruise badly. Okay. So for the facial mapping, you have looked at their face, you've asked them their concerns, you've now expressed what you maybe think.
Yes.
And then you kind of laid out a plan for me saying, these are the things I think you would benefit from. You could either do them all now or no.
Yes. Well, yeah. So I use 5 different modalities. So 5 different ways, and it depends on where the patient has like the biggest concern, or what we're trying to, it's almost like building a face house. Okay. So if I want to get the soil ready, I'm going to use something like Morpheus 8, the heated microneedling. If I'm dissolving fat, if I am needing to relax muscles. So I'm doing like full face Botox, Morpheus 8, maybe CO2 laser. I'm getting medical grade skincare on board, and we're getting like the soil ready. So then once that happens, the patient is able to experience that because is
that the first visit?
No, we're talking the first visit. Okay. We're getting the plan. Okay. So once I get you in there, we get the plan, I can just see how your personality is and how long these appointments are going to take. Then I can get you back in. We'll get you back in the book. And then after that, we're going into more of like building the foundation of the house, which is where Sculptra comes in. I know you talk a lot about Sculptra. You've had that done. And then maybe we're building like the bones of the house. So that's where filler starts to come in. Okay. Then we're maybe going into threading, which is tissue lifting.
Yep.
So I use all those modalities to get this amazing result, but I usually put most patients in a year plan.
Okay.
And some get done sooner, some get done later. Because the second question I always ask after what their hopes and dreams are in an initial appointment are going to be like, what's our project? What's happening?
Yeah.
How long do I have? What are the expectations? Are you getting married tomorrow? Or like,
when do you need this by?
So that's like become one of my really important questions, because there's some modalities that I think do more bang for their buck, and that I need to get in there to get results done quicker. And then my conversation might change of, we got to get to work.
Yeah.
Yeah.
And then in terms of finances, because people always want to know how much it costs.
Yeah.
And,
it's so important to me. I always give a beauty budget.
Right. So you ask them for a beauty budget, or you tell them?
I tell them the expectations of what this will cost.
Okay.
Yeah.
Okay.
I write it all out, and I actually text all the information to them. So they have it all on their phone. They have all the verbiage that we talked about, because sometimes you got to take all that in, because they don't realize that was.
Do you think most or a lot of people like you are doing that on first initial visits?
I think it's my niche.
Yeah.
Yeah. And too. I've learned that through being in the training world. I'm training other providers, that I'm like, there's something I'm doing here that's really making these patients comfortable and understand. So I think that was a blessing in disguise. Being a trainer is to really kind of be able to reflect on what your niche is as a provider.
Well, and two, as a patient or a client, it's like, if I'm going to be investing in this financially, my time, whether it's downtime, coming to the office, like, I want to know where I'm going. I don't want to just be throwing stuff at the wall and hoping that.
And that's where I think that when I start getting patients from other practices, that they have done that. It's like, oh, well, microneedling's on sale this month, or my friend got this, so I think I want that. And instead of the provider like being, upfront to say, I know that you see that, but honestly, I think you would do better with this type of treatment, because this is your main concern, whereas this treatment's only doing this.
Okay.
So it's being honest of like where their money's being spent, and like I said, the biggest bang for their buck.
Okay. What are our first signs of aging, and when are we seeing them?
Oh yeah, we're starting to see the signs of aging at 28.
28.
28 is like 25, 28. And I would say that the most common complaint, or what patients would come like younger in the chair for, is that something just looks different than what their picture looked like when they were doing pictures or taking selfies a couple years ago. Maybe they have it's usually pigment, like brown spots starting to come to the surface from all the damage that was done like in their teenage years, when you think that you're safe and like you can never age and will never see the age of 40 or when you're young and yummy and nothing can faze you. And then I would say that there's just like wrinkles, like things starting to stick.
Okay.
So when things start sticking, or static lines start sticking, that's when you know that you're starting to lose skin quality, and that, that expressions are being made that are just starting to stick. And those are called static lines. And that's where Botox comes in. And that's where, but really, I don't always just go straight to a Band-Aid fix like Botox or fillers. I really incorporate medical grade skincare.
When should someone really be investing in their skincare? 30.
Yeah, at least. I think 15, but.
And what should medical grade skincare have? Like, what makes it medical grade?
Medical grade just means that you've got certain ingredients that are maybe prescription level, that are going to be a little stronger than going like to Sephora and buying, a moisturizer that is going to be like something that your makeup brand sells.
Okay.
But the biggest number one that I recommend is Retin-A. Retin-A.
Is Retin-A different than retinol?
It's a derivative. So like there's a prescription grade Retin-A, there's a retinol. And so sometimes you start like on a retinol that's just a little bit maybe buffered, so it's not so intense or strong. But then sometimes you've got acne and like thicker skin types, darker skin types that just need more power.
Okay.
So you go towards the Retin-A. But the real important thing is just getting your skin ready for the Retin-A, and to really, tell patients you're going to have some flaking and peeling, because you gotta have something going on to have a result. So you have
flaking. Okay. And then how long does it till you normally get used to it?
If you can get over the hump, usually about a month, but everyone's a little bit different. And like they get tired of it. But even with Retin-A skin, though, it's still like, even though you're peeling a little bit, no one cares. Everyone's in their own world.
Yeah.
It's not that bad.
And medical
Your
grade
skin's
skincare is
already
what
looking
you can
better.
find at a doctor's office, correct?
Yeah, medical grade's going to be usually like at a plastic surgeon, dermatology office. Yeah, it's going to have just some key ingredients that are going to be, more prescription level.
Okay.
But Differin went over the counter. Differin's like a hybrid. You can get that at Target or Amazon. But I often recommend that, especially if patients are beauty budgeting and I need them to put their money towards the treatment.
Yeah.
And yes, I need them to have the medical grade skincare because that's only going to make their treatments even more effective. If I got healthy skin here, it's going to make their treatments like we did 2 or 3 in one.
Between.
Exactly. And it's homework.
I've seen Differin. I didn't know that was a medical grade.
Oh yeah. It's like a hybrid of a Retin-A, retinol. And it went over the counter a couple of years ago. And it's like $20, So
Right.
I recommend that for my teenagers. Retin-A is gold. That's what keeps your skin looking young. It's turning your skin cells over. So that's like a little...
Versus retinol. Would you use one or the other, or can you use
Retin-A
both?
is prescription. Like you have to write the prescription.
Oh, okay.
And you're going to see that more with dealing with acne.
Skincare.
Yeah.
Okay.
So a lot of times I'm referring those heavy acne patients to dermatologists.
But would someone like me who doesn't have acne use Retin-A, or I would use retinol?
I think you'd great the retinol.
Okay.
Yeah. Yes. Mm-hmm.
Which I think I have in that Zeo.
Yes, you do.
Okay.
Yeah, you should.
I should. I do.
Yes.
I do. But it does make me
flake a little bit.
Yeah, just a little bit. Yeah,
that's good. That's normal.
Is it possible that let's say 28-year-old walks into your office and you're giving them the same treatments you're giving a 45-year-old?
Well, yeah, possibly.
Okay.
Possibly.
So it's not like age.
Well, heat's the name of the game. So if I have someone that's over the age of 40 and I got to really put a whip to that collagen because they stopped producing as much collagen after the age of 28, then I got to rev it up. So I'm going to be using more heat modalities, which is like the Vivace, the Morpheus 8, things that are like a heated microneedling, lasers, even IPL, like when you're targeting brown spots. So even if I'm targeting a brown spot, a hair follicle, it doesn't matter. I got heat on the skin. Heat's the name of the game.
Okay.
So heat's really going to start turning around the clock and getting me there as opposed to someone that's younger.
Okay. So collagen, we start losing around 28. And that's what makes us start to look what? Hollow?
Yeah. Your skin quality decreases.
What if someone has a full face because of weight or genetics, or it's just their face shape? Are they going to also have
you'll start to see more sagging.
Sagging.
So different face shapes, you will see different parts, different aging.
Okay.
Well, if someone always had like a round face shape, you're going to probably see a little bit more jowling and more square. They start to get more square because you start to lose bone. Your fat compartments change. Like everything changes. Even though a patient might not look their age, you have to take in consideration underneath their skin. It is.
Okay.
So that's what I'm trying to target with someone that's over the age of 40.
Okay. So let's talk about Morpheus for a sec. Because when I did the Morpheus, I got a lot of questions that I did not know the answer
Morpheus that name has become almost as popular as Botox.
Yeah. I feel like people talk about it all the time. So can you tell us what it is and who it's for?
Morpheus 8 is my workhorse.
Yeah.
So it came out in 2018 and we were one of the first users of it in Nashville in 2018. So I kind of consider myself an OG with the RF with that too.
OG Botox.
No,
OG
right.
Morpheus.
I'm like blessed to have it.
Yeah.
But the radio frequency of Morpheus 8, if you have heard of Ulthera or Thermage, heated microneedling, even just plain skin pin microneedling with no heat, it's like all of that in one. But Morpheus 8, I think the best thing about it is I can hit fat. So it's almost like a jackhammer. So I'm breaking up
Feels
fat.
like a jackhammer.
It can. But especially like for like underneath the chin and like jowling here, it literally shrink wraps the face up.
So
is
if
what Morpheus
you're
8
someone,
does.
and then are you careful when you say too, if someone were to come to you and maybe it's not just face shape or age, like maybe it also is they're carrying extra weight. And so they have extra fat under their chin and they say, I want to get rid of my double chin, which I think you hear a lot of women say.
Yes.
As they get older, they start to get that fat pad almost underneath their jawline and into their throat almost. Is that is that for like fat from weight or is it fat from aging?
It could be both, but you're also losing bone quality. Okay. So if your chin is recessing and then you're losing some of the bone on the jawline, I have to address like building the face house. So I have to address that they're losing their volume from back here.
Yeah, their
and
ear.
And you don't realize that because that's the disease. And then they're seeing the symptom.
So losing your volume
from back
around your
here.
ear, like your
Well, we
earlobe
actually start
area?
losing volume in our scalp, but we have hair and we don't think about it because
Okay.
that's part of it.
Okay.
So then it's going to be pushing volume like here back, like, down. We lose skin quality here, and then our chin starts to recess.
So
as
your ear volume
it
goes
makes
through
it
your
seem
cheeks.
kinda,
Yeah.
but
Okay.
it makes it seem like this is all shorter and like you're like, in here. So if you want to think of extending the jawline, and you have
Okay.
to address the bone so that you can really address what's underneath here, because sometimes it's all combined. So that's part of the
Okay.
facial mapping when I'm explaining. I feel
Okay.
like my niche really definitely is in the lower face.
Which is not what people
Virginia
probably who came in for a problem ever thought they were
Oh,
going to get
no.
volume in their.
Honey, they
What is
get a
this area
surprise.
called? Under the ears? Is that called
The
something?
pre-auricular,
Okay.
before the ear.
I call it the
Pre-auricular.
earlobe. The
Hey,
pre-ear. Okay.
yeah.
So if you're listening and not watching, Keri was pointing to her ear, saying that the loss of volume there kind of tunnels
Underneath the
down
cheekbone.
through your
Yeah.
cheekbone and into your chin.
Mhm.
So if you build the volume under the ear,
That's usually where we use something like Sculptra because
Sculptra.
it builds the skin quality
Okay.
back.
Which
And
I
then I'm
had.
using
I did that.
Morpheus 8 to address the jowl, like the jowl fat, or the sagging skin or fat that's starting to fall.
Okay.
Because you have fat compartments underneath that too that are starting to fall.
Okay.
And so Morpheus 8 is going to shrink wrap the face up.
Okay.
And then if we're, then usually adding filler or Radiesse, which is a collagen inducer on the bone, we'll give back the anatomy that was there.
Okay.
And then also threads, tissue lifting threads.
And does that go into the neck too? Like when you see, like when you age and you start to gain that weight kind of in that center neck, is that
Yeah,
all connected to the same?
kind of.
Okay.
Yeah. And then you have your platysmal bands.
That's like
Those
if you make
bands,
if you,
like an E.
even with your jaw.
Yeah. So that's where I'm
Yes.
talking like Botox. I'm full face and neck Botox.
Yes.
Like when we're treating the whole, face, we're going from the tips to the forehead.
Yeah.
Like that's all your face, honey. Like you have to match
But you don't do
But-
Botox underneath the neck, do you?
on the bands.
Yeah, but not on your
Usually
chest.
that's where I'm using Sculptra.
Okay. You use Sculptra on the chest?
Honey, yes.
For what?
All over the body.
But
For
what is it?
The boob lines.
Oh, like the crease.
Yes, your creases. And you lose skin quality like in your arms.
I
Like
know.
That's
And now I'm
Sculptra.
looking at my arms.
Sculptra.
Well, and I saw you do Sculptra on someone on their thighs.
on
like
the knees.
Yeah, like above their knees. And I
Yes.
was like, but does that last? No.
Yeah. Sculptra is inducing the collagen in the skin.
Okay.
So it's magical crystals that make your skin young.
Yes.
That's what Sculptra is. So Sculptra will continue to work. I mean, once we get to our goal, you've got results for a few years and then you just maintain with like a vial a year. But it's even still working past that. So it's different than putting like filler in places. Filler is just a Band-Aid.
Yeah, tell us the difference between filler and Sculptra, and then I'm going back to the thigh Sculptra.
Oh, yes. Bodies do
I'm going to ask for a friend, yeah. Okay, the difference between filler and Sculptra, because I feel like filler has gotten a really bad name. And you say the word filler, and most people's eyes look terrified because they've seen bad filler jobs. They've seen plastic-looking housewives, all that kind of stuff.
Yes,
Migrating.
it's bad. Filler face, it's terrible. So filler is used usually on the bone.
Okay.
And it's hyaluronic acid, and your body does have hyaluronic acid in it. So it pulls water towards the area to make it have volume.
Okay.
So it has nothing to do with skin quality. Sculptra is, like I said, magical crystals that make your skin young, and it's injected in areas that I'm not going to be putting filler. So areas where we lose volume, like in the temples, back here by the ear, those mid-facial
Cheeks.
lines, and then also the skin quality that happens around the mouth area that you especially would see in females. That's where Sculptra is going. And it's kind of injected, not really the same way, but you could, if you didn't know what you were looking for, and it was still going underneath the skin, it's easy to compare the two. But we're not a Sculptra state. So when I
What does that mean?
So when I use the word
Like a blue state or a red state?
yeah, kind of. But in some states, Sculptra, that term or that treatment is just as popular as Botox. So it's just like people
It just
are
hasn't
used to
really
hearing
caught on as much.
So we're not a Sculptra state. So when I talk about Sculptra, I talk about threads. People are like, "What is that?"
Yeah. Because what is the threads? Threads is used in combination with Sculptra?
It can be, yes.
It's not
or
always.
we're lifting the tissue. So you're kind of giving like a dramatic but subtle result with
Is it
lifting
kind of like
the
a
skin.
facelift almost?
It
like
can
an
look that way.
internal facelift?
Kind of.
Does it go
Yeah.
away?
It
Like dissolve?
It does dissolve over
Okay.
time,
Okay.
but it also creates tissue simulation. So there's a big collagen push there too.
So you
They're
put
not for everyone.
why would they not be for
They
everyone?
just because people are scared because it looks crazy. It's hard to show on
After?
social.
No, it looks
Oh, it's
crazy doing
amazing
it.
after.
Okay.
But I have a face full of threads. I love them. I want
Yeah.
90 in me.
Do you do your own?
Well, I have to get some help.
Yeah.
Yeah, no, they're
That
hard. You can't do
seems
it. You have to be in the right space. But don't think I haven't tried.
I believe that you tried. Okay, so threads is kind of like an internal facelift, and you could do it with Sculptra, or you could not.
Yeah, so it would be the last thing that we do. So
Okay.
threads are something in the protocol that are like the anchor bracket of the house. It's the last step. Because if I'm trying to lift heavier tissue,
Mm-hmm.
it might look good for a second, but it's not going to last. So I need to really address all the issues, and then I use threads last to give
What about in
tissue
the
lifting.
neck?
Yeah.
You can thread your neck.
Yes.
Would it kind of be like getting a neck lift?
A little bit. Yeah. It looks pretty good. Yeah.
Not as effective
It's just not as long term.
as long term.
Mm-hmm.
If you have a neck lift, does it last forever?
No.
Oh, you have to redo it.
Yeah. Mm-hmm.
That's the one
But
thing.
if you do combination approach, so that's why if you're using Morpheus and you're doing your non-surgical treatments, even though you had surgery, because surgery is just cutting the skin.
Yeah.
So you're doing the non-surgical approach to make the skin quality, keep it good, then you can definitely go a long time with your surgery
Okay.
results. But if you're someone that's just getting the surgery, but not doing like anything from a hydrofacial to good skincare to maintenance treatments non-surgically, then I mean, that skin's going to just start sagging again.
So Sculptra lasts how long?
It can last 3 to 5 years, but I usually do like a booster every about every year and a half, just a vial, just to keep it good quality.
So
And the younger they are,
you should be doing medical grade skincare and surface level skin treatments.
Yes.
Like, what are your favorite? There's so many facials right now. I feel like to choose from. What are your favorites?
There's like a hydrofacial
Mm-hmm.
or a diamond glow. Like a hydrofacial is my number. I love that.
What's
That's
a diamond glow?
It's by a different company.
Okay.
Yeah, it's just another way of doing like a hydrofacial, of just getting surface like skin off.
Okay.
And infusing vitamins into the skin.
Okay.
So it's just it's something that an esthetician would do.
Okay.
And you can combine it with dermaplaning or with a light chemical peel. But those are like more of your esthetician base. And I love that at least once a month.
Okay.
Because every 30 days your skin cells turn over.
Okay.
So that's where, getting something that you're kind of helping the dead skin cells.
Okay.
Especially as you get older.
A huge thing I hear people talking about a lot and asking about is age spots, brown spots, sunspots, whatever you call them. For me, I feel like I get them kind of like on my cheeks, and especially
on the left side.
Yeah, and if I get
driving side.
yeah, because you're driving, and if I get a tan, I love having a tan, but I hate that they bring out
because it brings out the
sunspots.
melanin in the skin, so it's going to make the brown spots.
Yeah.
So your spray tan will make your brown spots look darker.
Right.
Yeah,
Amazing.
especially on the chest and the body.
Great.
Yeah.
Okay.
And that's why treating the brown spots will make your spray tan look better.
So what is your favorite? Because I hear like peels, I hear like BBL, IPL. There's so many terms. I think sometimes we get overwhelmed.
Sure. And you're talking to a girl that loves it all.
Yes, I know you do. Because
So-
you do love it all, but you also know about it all. So I guess that's what I'm saying. Like if someone right now has never done any sort of laser or peel, and they're, I don't know, in their 40s or 50s, and they are just hating the sunspot. Is sunspots and brown spots the same thing? Age spots?
Yes.
thing?
And some of them need to be taken off by a dermatologist too.
Oh, they do? Okay.
Yeah. Yeah.
Well, if I'm at home sitting there thinking the one thing that really bothers me is my uneven skin texture, and I have all these sunspots, what should I be looking at researching into doing?
I would go medical grade skincare always.
Okay.
And then I would start into mild peels and go to there, because I wouldn't throw a real aggressive peel. Would not on someone's skin that wasn't ready yet.
Okay. What does ready mean? Like
healthy yet.
Okay.
So when you're using medical grade skincare, you're going to see an improvement in texture, laxity, your glow, your pores, your brown spots, all of that will improve. I know you're targeting one thing in your mind, but you're going to get an improvement with everything. Like you're just going to look better.
Okay.
Yeah, you'll be more face confident. People will give you compliments. So so I would say, medical grade skincare, and then knowing all the options. So in a proper consult, using combination therapy with chemical peels and lasers should be verbiage that you've at least heard of before, but maybe we're not going there yet.
Okay.
But sometimes you mix in some lasers with the peels. And if someone's in the sun a lot, then I'm probably going to refrain from doing lasers on them.
Is that the BBL, IPL? Okay.
Yeah.
And
they're same.
They're the same thing.
Basically, yeah. It's just a little bit different light.
Do you have to keep having it done?
You do need to be consistent with the treatments to get,
What's that halo one? What's that one?
A halo is like a hybrid. It's like a CO2 resurfacing.
It's supposed to be very painful, I've heard.
But it's like a hybrid. So it does like resurfacing. Then also it has like another different wavelength with it. So it's like you can make that shout, talk, or whisper too.
Okay.
As a provider. I don't even.
Small, medium, or large.
As long as you're numb,
how much do you want your pain to be?
Too. It's always going to be a little spicy.
Well, and everyone kept saying how painful the Morpheus was going to be. I didn't think it was that bad. I actually found the BBL.
You were properly treated.
Yeah, but I feel like the BBL was more painful.
It's because it's startling.
It's startling.
It's startling. The light is startling, and you kind of jump from it.
It felt like hot rubber bands.
Yeah, but you also can be numb for it too.
Yeah, I don't remember if I was. I mean, I feel like I was probably.
Sometimes you're not really numb for it because you don't think about that you could be.
Yeah.
But on my patients that are pretty, startled, and they're jumpy, I require them to have at least 10 minutes of numbing.
Okay.
Take the edge off.
Microneedling and microneedling the PRP, because I know you are a big fan of PRP. Can you talk about that a little bit?
Yeah. I feel like PRP, in my experience, is that when you apply PRP with microneedling or Morpheus, anytime you're putting holes into the skin, it helps heal a little bit faster, but I don't feel like it really creates so much of a wow factor.
Okay.
I get better results when I inject it. So it's my go-to for around the eye area, PRP. I draw your blood.
Okay. So, yeah. Okay.
Spin it down.
When you say spin it down, like you have a little lab that you're just whipping it around in?
It spins around and it pulls like the yellow part, the youthful part of the blood out. And that's what I'm putting back. Because if you, like in orthopedics or in like joint injury, they're using PRP to inject to heal so it goes to where the injury is to heal it.
Okay,
so in this case, it's collagen.
You inject it like with a needle.
With a cannula. Yeah.
I've never done that with you.
Well, I'm sure it's next.
Yeah. So you think that's more effective than using it through the microneedling tool?
Yes, I do.
Okay.
Yeah, definitely. I'm getting it into all levels of the dermis, but I don't use that as I use like around the eye area.
Why around the eye?
Well, it's gonna repair the skin quality, kind of like Sculptra.
Yeah.
For around the eyes, and it also is amazing for dark circles. It's my go-to for dark circles. I will do PRP series, and before I will even attempt tear trough filler. I hate tear trough filler.
Okay, is tear trough filler if you have really sunken eyes or you have bags under your eyes?
Yes.
Okay.
Like hollows.
Yes. Okay. What if you have bags under your eyes? Is that like a surgical thing?
It's usually surgical and it's usually hereditary. And Morpheus 8 does a damn good job at treating it non-surgically. There's a special tip we have for under eyes if it's a fat pad. Yeah. And normally it's when I'm calling in Dr. Hightef just to talk to the patient to be like, look, this is what this is. These are the expectations. I'm sure your mom or dad has this, and usually they do. It's hereditary. So when it's a fat pad, and as you get older, your fat pads fall anyway.
Yes.
So it becomes
right.
So there's a surgical option, and which is you go under for that, and then I get pretty good results with the Morpheus with that.
Okay.
It just takes several treatments. It takes longer.
How many treatments?
I can't put a number until you're happy.
Yeah, until you're happy.
Yeah.
Okay.
But so in radiofrequency in Morpheus world or in with Sculptra, you're going to see about 10-15% result with one treatment, which I'm the type of person where I do a treatment, I know right then I'm going to love it, that it's going to be amazing, that I love it. Yeah. And so I get excited. But most of the world, I feel like needs to have 25%. And
the next day you're like, wait, I don't look 10 years younger.
I know, but I think I have this image, or I have this I feel like I feel it. And I'm like, I just know it's amazing.
It's going to be good.
It's going to be good. I already feel more confident in my skin. But 2 treatments at least.
Okay.
For most to start being like, okay, I see this. I've experienced this. I trust this. Okay. But, depends on the severity. It depends on, the patient. Sometimes they're good with just the good results. Yeah. They don't care about even getting better than that.
Okay.
And that's sometimes where I have to hold back.
Okay.
Because I get excited.
You do.
If I can do one more. If I can just do one more.
Well, and do you find certain patients are like, just do whatever you want. I trust you. Yes. Go for it. And then other patients are more like, oh, I don't know.
I feel like most of my patients at this point, after being a provider for 20 years, they know that I'm a power girl, and that I'm gonna we're gonna go, and that's the personalities that I get. And then for others that want to kind of slow down a little bit, I might send them to the nicer nurse.
Right. You haven't sent me to the nicer nurse yet, and I feel
shared
like
you.
I'm a little like, oh, I don't know.
I would say, but you're not skeptical. That's a big word. You're
cautious?
inquiring.
Inquiring. Yeah.
You're inquiring.
I have a lot of questions.
Oh, I don't know.
Yeah.
Yes.
Yeah.
But also, my stuff usually comes with some bruising, and then
I don't feel like I've said no to really anything.
I have a way of.
Yeah, you spin me right into it. I'm like, oh my gosh, I'm actually doing it right now. Okay, I want to go back because you talked about fat pads. Let's talk a little bit about, I was saying, I saw someone talking about this the other day. I feel like it's become a huge thing. Is this buccal fat removal, which buccal fat is where? Below your cheekbone?
It's the area that's near your mouth. It's this puffier area that's like
where your smile line is.
You got it. Yeah.
So people think my face is too full. I want more of like a chiseled jawline, Kardashian type.
Yeah.
Look, is that the point of it?
Yeah. So there's just like an extra layer here that they want this. I don't know. It's almost like an avatar look.
Yeah.
It can be. But
is it lipo?
It's a removal. It's like it's like, oh my gosh. It's like this tiny little pad, like a little buccal pad. It's like, and they go in through the inside the mouth.
Oh, so it's an actual pad. It's not like they're liposuctioning. I envision them like lipoing their face underneath their cheekbones.
Oh, yeah, no.
Okay.
That's usually done here.
It's an actual pad.
It's like this, it's like this, it's
like a little square pad of fat.
It's more almond shaped but yes.
Okay. See, I didn't realize it was an actual thing.
And you don't really have to go under to do it either, which kind of makes it more accessible to have done. Like if you're doing an upper bleph,
then
what's
you don't have an eye lift?
Yes, they're taking the skin off top. It's probably the easiest. I think it's the easiest procedure and like probably the biggest wow factor.
Buccal fat removal?
No, upper bleph.
Oh, the upper eye lift. You don't have to be asleep for an eye lift?
You're just numbed with lidocaine. Yeah. No, I would never talk about it. I had it done, and I would never encourage others to do it if I didn't think it was the easiest thing ever.
What was the downtime?
I mean, you walk around with celebrity sunglasses on for a day or two.
A day that's it?
Yeah. Your stitches come out. You have a little bit of bruising, but it's so easy.
Wow.
Yeah.
Who's a candidate for that? If you have like a hooded lid?
Yeah. If you can pinch.
Like we're all sitting here like.
I know, right?
Yes. I mean, I can pinch, but I don't feel like I have a.
But you have a little bit more of a protruding brow bone. So you're probably more of a upper facelift.
I just need an upper facelift.
No, I said you might be more of that. I'm going to stay in my lane. I'll let Dr. Hightech take those type of questions.
John, Keri told me I need an upper facelift today. He'll be like, what the heck? No.
This is the girl that bruises my wife.
Okay, so the buccal fat removal, back to the buccal fat. The side effects are
when you age, you lose fat. Yeah,
right.
So you lose fat in your face, and you need that because it can make for a really, really, really
hollow look.
Yeah,
that's what this lady was saying. If you get it done in your 20s, and then you get to your 40s, you might have a really wonky.
But normally, you look at the parents, like the mom or dad.
Oh, okay.
So you look at the parents, and if they have it pretty heavy, then it's more than likely removing it. You'll be fine.
Okay,
but there's a good doctor will definitely make a thorough assessment as opposed to being like, okay, let's just do that.
Okay.
Yeah.
Okay. Yeah. Okay. I'm going to read you a few complaints, say women would have, and I'm going to ask you to tell me kind of just off the cuff, like what would be a good treatment for it.
Okay.
Okay. Fine lines.
Botox.
Deep wrinkles, deep lines. What do they call those? The 11s?
Okay, start over again. Okay. Fine lines?
Yes. Fine lines.
Medical grade skincare.
Medical grade skincare.
Yeah.
Not injections.
Not yet.
Okay.
They're not sticking.
Oh. Okay. So
I'm all about prevention.
Okay. Deep wrinkles, deep lines.
Botox and medical grade skincare.
So if the lines aren't sticking together,
well, when you're making an expression, you can make you can have lines.
Okay.
It distracts me. I don't want I don't want to have lines.
Okay.
But if they're sticking when you're not making an expression, they're static.
Oh, okay.
Then that's how you know. I mean, I got to get some Botox in there and medical grade skincare.
Okay.
So, okay.
Because Botox, sometimes I've heard if you have those really, I don't know what to call them, like the deep lines, you need a filler.
Well, you can't put filler up her face like that.
Oh, you can't?
No, it's
You
super
can't put filler in your
dangerous.
forehead?
Oh my God, I would not.
Why?
You have a major arteries and vascularity, and you will be
Oh.
blind, and there's all kinds of side effects.
Do you think people do it?
Yes.
Yeah. See, this is why I
It's
think this is
scary out
great
there.
because
It's
I feel
scary
like a
out
lot of
there.
people don't know that.
It's very
And
scary out
I
there.
honestly thought if you are someone who say has never done medical grade skincare or use that and you have those lines across your
Right.
head,
Well,
I
here's
always
the
thought you
deal. If
needed to
I'm
get
relaxing the
filler
muscle, if I'm relaxing the muscle that's causing that wrinkle
with Botox.
with Botox,
Mhm.
then your muscle isn't working against me as we're repairing your skin.
Okay.
So medical grade skincare,
Okay.
microneedling, peels, like anything to get your skin healthier, the skin quality healthier,
Yeah.
while I'm not fighting against that muscle making that wrinkle.
Okay.
So that's the combination approach.
Okay. Gotcha. Okay. So fine lines, medical grade skincare,
Mhm.
deep wrinkles, deep lines, Botox,
Yeah.
skin sagging,
Laser,
Morpheus,
radio frequency,
radio frequency. Okay.
Yeah.
So we didn't talk
I know.
about radio frequency
Morpheus. So
Okay.
radio frequency is going to target more, it's going to shrink wrap the face up
because of the heat.
because of
That
the
comes
heat.
with it.
Yes,
Okay.
but the heat from any laser is going to cause rejuvenation on the skin,
Okay.
but specifically radio frequency.
Okay. And there's other tools other than Morpheus that have radio frequency, right?
Mhm.
Like,
It's the big girl.
okay.
It's going to fat. Vivace is another one.
Vivace is a microneedling, right?
It's like its baby sister.
okay.
Yeah.
That's
it's
the
like
microneedling with radio, the
heated-
RF
Right.
microneedling. See?
Guys love that. I do Vivace on my guy rejuvenations all day
Really?
long. Because
What is it doing for them?
It doesn't hurt.
Okay.
And we know how guys are with pain.
Because they're babies.
Yeah. It hurts to be handsome though.
It does. It does hurt
Yeah.
to be handsome. Okay. So skin sagging, we've got the radio frequency. This could be the same. Neck crepiness. I hear we use that word crepey a lot.
Laser and Sculptra.
Laser and
I
sculpture.
sandwich them.
Okay. So if I went down to leg crepiness or arm crepiness, which
Sculptra and Morpheus.
Sculptra and
Oh
Morpheus.
man, yeah. Yeah. But on the body, Morpheus is a little bit more intense. It's like taking a bullet. So you have to make sure you're numb. It's like taking a bullet.
And like that's a large.
I lidocaine numb. Mhm.
But even like I'm thinking like, okay,
I
how
only
much
do certain-
Sculptra do you put in your full thigh? Like
Well,
that's a
you
lot
do
of
in
vials.
sections because you also have to watch out for lidocaine toxicity. So I can't like fully numb your whole body.
What's lidocaine toxicity?
Lidocaine toxicity is a big deal. I mean, like you feel it. Like you feel like you're going to pass out, and
If you
it
have
can
too much
affect your heart
lidocaine?
rate and blood pressure. Yeah, the only way to reverse it is with a Xanax. And
This
it can
is-
actually go. You have to go to the hospital sometimes too. Like you have to. It's scary. So you have to, as a
Just
nurse,
sign a
there's
waiver?
stuff behind all of this too. Like
do I need to sign a waiver before I do it?
no, but
Oh.
I mean, it's just that's just something I think that should be addressed though.
Yeah.
When you have, if you're like putting lidocaine on you all over,
Yeah.
and it's systemic,
Yeah.
and then
Well, and I
you
have a
are
single-
injecting lidocaine, especially with epi, to numb the area, and then you're doing an intense treatment. Like you only can do certain much of your body area, and if you don't weigh a lot,
Yeah.
then that matters in the dosage of lidocaine you can get.
Oh,
So,
see,
yeah.
this is why I think it's important though, because I think a lot of people just go to
I know.
random people and they don't know, and then they end up in a bad situation.
Mm-hmm. Yeah.
Okay. So neck, arm, so you can treat like forearm crepiness and
Oh,
upper
yeah.
arm crepiness
Mm-hmm. Sculpture all day long.
and hand.
Oh,
Okay.
that's my
That's what I
favorite.
wanted to ask
Yeah,
you. Okay. I have
Radius.
not done that.
Yeah,
Radius.
we'll do that next.
What is that? A filler?
So Radius is kind of like Sculptra. It's going to induce collagen, but
Okay.
it's white, so
Okay.
that when it's injected, it's like it's just you can kind of it's not as transdermal. So it just gives So
But-
Radius, there's a Radius I like to use in body
Okay.
too.
So here's my question. If I inject the filler in my hand,
Uh-huh.
does it make my arm, at least to myself, look worse? Because your hand looks so good now? Do you know what I mean? Like, does it make your arm look more aging to you because your hand looks so
that's
youthful now?
everything. Something looks better.
Yeah,
it's
that's
like
true.
with lipo. Something looks better. You remove fat, then it's going to make
Yeah.
another area look bigger to you if you do gain weight because it's like an illusion.
True. Okay, and also, isn't Sculptra what they use? Speaking of lipo, isn't
Mhm.
Sculptra what they
Or
use
hip dip.
for Brazilian? What do they call it? What's BBL stand for?
BBL, Brazilian butt lift.
Brazilian butt lift.
Yeah.
That's what they put in your. So it's not
Well,
actually
it's your
butt
fat.
implants, right?
No.
But there was a thing.
Yeah.
Yeah. But now they just put. Oh, they put fat. I thought they put Sculptra in your butt.
Well, you can use Sculptra.
Okay.
But Sculptra's only going to do so much. It actually improves the skin quality. I think Sculptra is amazing for cellulite.
Really?
Absolutely. It's skin quality. So yes,
I just
but
need.
you have to be strategic on where you're. And there's like a hip dip, so you have to be strategic on where it's at. And
Yes.
most females will have a hip dip, and it just creates this like get your curves back. But if you're doing like a full like a BBL
Yeah.
or a skinny BBL,
Okay, so tell people what a BBL or a skin, because I feel like there's a lot of misconceptions about what that is.
so a skinny BBL is basically on someone that doesn't have a lot of fat.
Okay.
But when you strategically take like from the flank, this
which
area,
is your back,
which is
kind
like
of hip,
this
above your butt cheek.
Yep.
Yeah.
And then maybe it's a little bit through here.
So they lipo that out of
They
you?
lipo that out,
Okay.
and they re-inject it back into the top of your butt or the hip dip.
Just with a needle?
Yeah.
And then kind of mush it around?
No, actually, you can't lay on it for at least 6
What is
weeks.
the surgeon doing? Is he how is he shaping it? With his hands?
No, because it's filtered down.
Oh,
So
okay. So it just kind of
it
finds
goes
its
to a
place.
filter. It's not like you have it's not like you're imagining like butter, fat.
Yes, that's
and
what
then
I'm
you're putting
imagining.
that butter fat
Yeah,
here.
like Play-Doh.
Oh yeah,
No, okay.
It's broken. It's like spun down. Like it's
Like a liquid.
like a liquid.
So when they put it in, it kind of just finds its place?
It's like almost like when you're doing Sculptra.
Okay.
You're fan. It's the way that it's with a cannula.
Okay.
And, look at me going in like this.
Okay.
Yes. So it's like
and a
fanned around.
cannula is like a long little tube that
like
you
a
can
long
put a
straw.
needle through. Yeah.
That is attached to the needle.
Okay.
And so you are kind of sculpting. Like you're
Okay.
sculpting. Yeah. But there's like you have to take care of your BBL afterwards. Like you can't lay on your butt. Like you can't sleep on your butt. You have to have pillows underneath you. Even like driving a car, you have to be like in a certain little like booster seat so you don't put pressure.
Because what will
on the
happen if
graft.
you do?
It won't be as projected.
Okay.
Yeah. So yes, because it's still healing and
So
everything.
the objection or the goal of a BBL is to just have a more rounded butt?
It's just a reshape.
A reshape.
Okay. Yeah. And
Okay.
I think like the flank area,
Yeah.
like we talked about this area back here by the ears being
Yes.
like that secret kind of area that when you restore that, it kind of helps like, everything. This is that secret area.
The flanks.
The flank. Because it will elongate the length between the ribs and like where the top of your butt starts.
If you lose the flank and put the flank into the butt cheek.
Sometimes just by losing the flank, it still makes your whole butt look better because it elongates. Yes.
Dang.
That's a secret area.
That is a secret area. Okay.
Yes.
Neck crepiness. Okay, this is probably back to maybe the deep wrinkles, but loss of volume all over.
Sculptra.
Okay. Not filler. Sculptra. Sculptra is your go-to. Okay. Just the looking tired. So many women I hear say that. I just look tired all the time. Botox. Yes.
Yeah. Botox lifts muscles and brightens you up.
So I didn't get Botox till I was 38.
Okay.
First time I ever got Botox. And I went to a nurse injector and I was terrified. I was going to look like a Saturday Night Live character. And she said to me, I will go real conservative with you at first. And she said, I promise what's going to start to happen is people are just going to start to ask you random things. Did you do something to your hair? Did you,
Yes.
I like your lipstick. And I was like, okay, whatever. And she said, it'll take about 2 weeks to kick in. I swear, within 5 days, everywhere I went, people were asking me,
Yes.
I love your sweater.
Yes.
Did you do something to your hair?
Or the
I like
best
your
is like
makeup.
when the husband like pays you a little bit more attention.
Yeah.
Like he knows that something looks better.
Right.
Or maybe that you're just feeling a little more confident because you see it.
He just doesn't know what.
So I always say to my patients, like, does your husband know you're here? Your boyfriend knows they know you're here? And when they say no, I'm like, oh my God, tell me the day. Text me the day when you get that. When they're
they
just a little
notice
bit
it?
more clingy, when maybe you can just get your way a little bit more. It's like the power of the eyelashes.
Yeah.
I always felt like when your eyelashes are done,
Yeah.
they're just like, gosh, you're so pretty.
But
get
you
more
also,
of the
I think it's
compliments.
true. You have that feeling kind of about
Yes,
you,
and I definitely
right?
think that comes out too.
Okay.
Yes. Yeah.
Okay. Skin unevenness. We kind of talked about that with the laser.
Uneven. Yes.
Okay.
Laser.
Okay. And then the age.
And peels.
Okay. And the age and the brown spots. Is there ever an age where it's too late, where someone's like, oh, it's too late for me now. I'm, I don't know, 60, 70, 80. I've never done anything. It's too late for me now.
If they have that mentality.
But I'm from a provider perspective, if someone came into you at the age of 70 and has never done a single
I have
thing.
70-year-olds that look that look better than some 40-year-olds.
Okay.
So I say no.
Okay.
I
Because
say
it's not
no.
like, I guess like
There's always a way to make something look a little bit better.
okay. It's not like the wrinkles are too far gone or it's too set in.
I feel I cannot even think that way. I can't.
Those are fighting words to Keri. She'd like get her gloves on and be like, okay.
There's always a way I think to make your skin look healthier.
Yeah.
So, can we, I mean, right. There's surgery. I mean, yes. So
Yeah. Do you ever have women come into you with like photos of someone else that they want to look like? Does that ever happen? Or is that more of like a surgery thing? Oh, sorry.
Um, it might be like I like this girl's lips
Okay.
shape
Yeah.
type thing.
Okay,
But
let's
I
talk about
feel
lips. We
like
didn't
I
talk about
don't.
lips.
Yeah, I feel like I don't get a lot of. I want to look like this person.
Okay.
Because that's just body dysmorphia 101. I will
Yes.
shut that down.
You would. Okay.
100%.
Okay. That's what I was going to ask you. Because I think a lot of the time too now with like social media and filters and how we see how we look with a filter and then we go back to the normal camera.
Oh my
And
gosh,
it's
I
kinda like,
know.
oh my gosh.
I know. It messes with your mind. It keeps me in business. I know.
Right. Yeah. So
But it
how
is.
do you ever like have women that come in that you're like, I'll never make you look like this because it's a filter?
I maybe it's the way that I change the question around
Okay.
where I'm like picking out, trying to figure out in their mind what they're seeing
Mm-hmm.
and what they're trying to tell me type thing.
Yeah.
So I think, I don't know, I have a good way of doing that, but I honestly, maybe it's the clientele we have.
Yeah.
Maybe it's just that they don't, yeah.
Okay.
I would say that my younger girls want more of that glassy skin. It's like the Gen Zs. They want the glassy skin. They want the lips.
The lips.
Yeah.
Which I'm always like, oh, girl, this is it for you. Like you're in the good stuff right now.
Oh, I know.
Okay, lips. Let's talk about lips because I feel like lips kind of have gotten a bad rap the same way filler has. And I know you are very open at talking about going to the right provider because you have to do a lot of, I don't know what you call it, revision.
I feel like I'm a mega attractor for bad work, overdone work, where thank God we have an antidote called Hylenex that can dissolve filler, HA fillers. So fillers. Some fillers there could be fillers that are permanent. Hope to God they would never be injected in someone there. But there's an antidote, and it's mainly for an emergency reason because there's a lot of vascularity in the face that people don't think about when they're watching these injectors on social media. Just kind of go to town. But there, if some filler gets into a vascular area, it's almost like a stopper. So the blood flow can't go here or there. So you start to get deadening of the skin and sometimes blindness and other things. And so, but that's where Hylenex is used. Because if you see that on your end, like blanching, or if you, there's just certain things, key things that a good nurse injector would, or hopefully any nurse injector would know what to look for, then you inject Hylenex, and Hylenex is going to dissolve the filler, basically turn it into water so that the skin can repair. But I find that I go through more Hylenex than from just, migrated filler, misdone filler. Sometimes the patient has too much, they don't realize it. Then I do in an emergency. So you always have Hylenex on board in the office just for an emergency, always. But I go through it fast because I'm a mega attractor for bad work done, which kind of is a challenge to me, but I kind of like it.
Yeah, I know. Well, you post a lot of good photos that you're like, wow.
Yeah.
Because if someone wants to get their lips done, if someone's, and I get what you're saying about like the 20-year-olds, but I guess I'm talking more about the women who have hit like 40 and 50 and lip thinning.
I call it a
is
lip
a thing.
reshape.
Okay, it's a lip reshape is what you call it.
Yes, a lip reshape.
Okay.
And a lot of times it's the whole project area.
Okay.
Because if someone has a heavier fold, or they have like a really recessed chin, or they have like the resting bitch face, you have to address all the reasons of why their lips are going to be the symptom. Because the disease could come from here, from here, from here.
So it's not like a one size fits everyone.
Right. So, but whenever I am addressing these areas, I normally go in for like a little bit of filler in the lips, like the corners, the Cupid's bow. It starts to spread. And so even just putting that back will brighten up your whole face. And then the bottom lip on a female should protrude about 2 millimeters. So if we're working on someone's cheek area and then we have a good chin and their lips are still like it looks weird from the profile. Okay. So it's kind of like the whole reshape.
And I remember hearing once that even though all these girls are wanting really big upper lips, that naturally your bottom lip should be bigger. Is that right?
Yeah. There's all kinds of shapes, but I go for like the heart shape.
You go for it.
Like,
what if someone wants lips that you're just like, wow, I cannot. Do you ever think I can't let you walk out of here like that, even though you want it?
I tell them no.
You do?
I tell them no. Okay. You're done. Baby girl, you're done. Okay.
Because some of them want the big Kardashian lips.
Yeah. And like I said, I don't feel like that's our
brand.
Right. And I feel like that's where social media is also a blessing and a curse, because if you put your work out there, you attract what what you're putting out there too. So if I was known to do that look, that's probably what I would do on most people. And that's the ones that would seek me out.
Okay.
So I feel like,
Okay. So if someone does have filler work that they're not happy with, whether it's in their lips or their face,
it can be dissolved.
It can be dissolved. Fully, completely dissolved in one visit?
No, it can take several. It can take several visits. And then you also have to kind of handhold if there's a lot of filler work that was done here and it migrated to the fat pad, or if it's just misplaced or put in with the cannula.
Yeah.
If it came from other injectors that you don't know like exactly how much was in there, how much like you think but you don't know what's underneath there, then that's where you can't be like, okay, it's all gonna be gone in one treatment.
Okay.
But you also get like a deflated balloon effect on the skin with more aging skin. So if I'm taking down a lot of filler, then I have to like really talk to them about your skin's gonna look like a deflated balloon.
Yeah.
So I'll treat that with Morpheus. We're gonna tighten it back up.
Okay.
It'll adjust, but just to know you're gonna probably not like your skin after this.
After the filler's gone.
Mm-hmm. Yeah.
Okay.
It takes around 3 days to start breaking up when it's in the tissue.
Okay. If someone were seeking out, if they're not in Nashville, if someone is seeking out a provider, what should they be looking for?
First, look at them.
Okay.
Do you want to look like that provider?
Right.
Do you like the way they look?
Okay.
Sometimes they got a lot of ammunition there.
Yeah. Well, what if it's a man?
Huh?
What if it's a guy?
A guy injector?
Yeah.
Oh, I mean, the way they look?
Yeah. Well, I'm just saying, like, because you're saying, like, think about how they look. Do you want to look like them? I'm like, do I want to look like Dr. Hataf?
Oh, no.
Maybe if I was a guy. But like, should you be asking your friends? Should you be looking on
referral
socials?
second. Referral second.
Okay.
So referral, who do your friends go to? Do do they look great? Do they like what, definitely referral.
Yeah.
And then I do think social has that blessing and curse too of looking at the niche.
Yep.
But then also just, do you feel comfortable when they are explaining to you the plan? Do you have any red flags? Yeah. Looking at their portfolio, that type of thing. But I think that when you when you are asking the questions and if you're, getting a response you're just not comfortable with, or you just kind of got that feeling like, I don't know, I also don't know if this is my person, go with it.
Okay.
Go with it.
Okay.
Yeah. But number one, I think look at them.
Okay.
And then also referral would be number 2.
Okay.
Mm-hmm.
All right.
And safety. I mean, are they in with a plastic surgeon?
Yeah.
Is it a pop-up shop? Like really look at, the safety.
Pop up in the Target parking lot.
Yeah. They're everywhere.
Don't do it. Don't do it.
I know.
Oh my goodness. Okay. For skincare, I know you talked about medical grade skincare. Are you talking like face wash, toner? Like what are the things we should be doing morning and night?
Medical grade skincare wise, vitamin C, retin A, and growth factor.
A growth factor.
So growth factors come in. Basically, it's like putting a big ball of filler on your face.
Okay.
So it's going to keep the skin yummy.
Yep.
And so vitamin C is going to help with cellular turnover, your brightness, help with antioxidants, and just, that sun effect. And the biggest thing in all this too is protecting your skin with sunscreen.
Okay.
I feel like I don't hit on that a lot. I just feel like it's assumed, but you want to protect your investment.
Do you wear a separate sunscreen or one in your skincare?
When it comes to sunscreen, I'm not one that pushes an exact one.
Okay.
So with mineral makeup and with minerals in a lot of the, products we're using on our face just for makeup wise, it's minerals of physical grade. It's got physical grade zinc and titanium in it, which is a physical grade sunscreen ingredient. So physical grade sunscreen is going to help block out the UVA and UVB rays, which is the aging rays too. So if you have more of like a chemical sunscreen, and then usually it's the chemical sunscreens that are going to have like those 5 big long words, ingredients.
Yeah.
And that doesn't always block out all of the aging rays and the skin cancer rays.
Okay.
So physical grade sunscreen, zinc and titanium ingredient is often in mineral makeup. Okay. So when you have mineral makeup on, if you're wearing that and you have maybe like a tinted SPF underneath it, you're definitely protected. Okay. I think the biggest thing is reapplying. I
Yeah.
mean, because
I don't
if
think,
you're,
I know. I never reapply. I'm bad at reapplying. Well,
and I am
especially if you put
too.
makeup on.
No, I am too. I mean, you're at
Yeah.
the beach
Yeah.
and you're drinking and you're
Yeah.
having fun and you're in
Yeah.
the water and you're like, where'd the time go?
Yes.
And it's like, okay,
And now
right,
you have
I'm
a
looking a
sunburn.
little red right now.
Yeah.
Yes. Yes.
Okay. And I know you say medical grade skincare. I know you said that different. If someone does not have medical grade skincare in their beauty budget,
Mhm.
are there like just different? Is it an entire line or it's just
No,
one
no,
product?
it's a product.
Oh, just one
Yeah.
product. Okay.
Yeah. It's just, yeah, it's
Are
a
there
buffered
any other
retinol.
lines that?
Difference, it was prescription and it's over the counter.
Okay.
And so I always just go towards that.
Okay.
And it's
Anything
very
else that's not costly that you like?
For acne, there's a penoxyl wash that you can leave on as a mask that helps with acne a lot. Just your basic like CeraVe, if you need, like if you're peeling and that type of thing. Anything that says dermatology recommended. But normally it's
Is
like
that a thing? Is that truly like, does it actually have to be dermatologist recommended if it says it on the bottle?
Well,
I wonder.
do you mean like if you're going like to Sephora to buy skincare?
Yeah, or Target or Walgreens.
Yeah. I normally go towards like your Cetaphil, CeraVe,
Okay.
and Differin, which is totally there.
Yeah.
And then the Penoxyl for breakouts.
Acne.
Spot treatment. You can do like a salicylic acid spot treatment. That's just over the counter.
Okay.
Like those are like your basics.
Yeah.
Yeah.
Okay.
But when it gets into skin treatments like that are like dealing with acne or just that hormonal skin, I normally send to a dermatologist because sometimes you need to get things situated systemically, whether it's, oral medication. And then we're kind of there to help treat the aftermath.
Gotcha.
Because if you, yeah. But a lot of patients want to come to a plastic surgeon's office to treat their acne because we definitely do have lasers for things like that. But I often, push towards dermatology to get it under control.
Okay. Because you're not doing facials per se for you. You're just doing more of the treatments, right?
Well, my best friend Lauren's my esthetician that we've been together for 16 years at the office. And so she's going to do more of your, like hydrofacial, dermaplaning, peels, and they're medical estheticians. So they can do laser removal, IPL, all of that. I feel like I do more of the big girl stuff. Yeah. So we split.
The big guns.
Yeah. Okay. So you might see her more. And then in between seeing me once we get to maintenance. So once we get to maintenance, I might just be seeing you back every 4 months for Botox.
Yeah.
And then in between, they're doing their skin treatments and they're seeing Lauren.
Okay.
Mm-hmm.
Okay. Love it. Is there anything I have not asked you about that you love?
I don't know.
We've touched on like pretty much your entire, like I have like Keri's bag of tricks. That's when I was thinking about to talk to you today. I was like, what have you ever mentioned to me? What have I ever done? What have I ever seen you talk about on Instagram?
And I'll have new tricks too.
Yeah.
Yeah.
I know you have a lot of celebrity clients and I'm not going to ask you to say their names, but are there any kind of treatments or products that you love to use for them to kind of get them like photo shoot ready, red carpet ready, video ready, all that kind of stuff?
Yes. It's using, I would say, Sculptra, threads, and their Botox. And then there's a fun product that we have that is a treatment called the PRX, and it's a skin lifting treatment.
Oh, yeah.
And it kind of just gives this like you just did Botox or treatments. It's temporary, but it also does like rejuvenate the skin somewhat. I use it on my guys all the time too.
How long does that last?
I would say the glow from it lasts for about 3 or 4 days.
Okay.
Mm-hmm. So it's something that could be done in the office that takes 15 minutes.
PRX.
And you don't have to really, you can still go with your normal skincare. You don't have to change anything up. You can go straight from there to, makeup and all that. So that's a popular thing that we do for red carpet look. Okay. For our celebrities, yeah. Right. Or for anybody that's just, I did one this morning.
I know. Keri walked in and I was like, Dad, what did you put on your skin? You look so good. I was like, did you put that snail stuff on your skin? You did.
Oh, yes.
Oh, yeah. What's the snail stuff? Tell everyone about the snail stuff.
The BioPel, I know the snail,
so funny.
The more I know. So the BioPel is like a very big, it's like a very strong growth factor. Yeah. But it has this glazed donut.
It does. It's amazing. I need to get more. I ordered some on Amazon when you talked about it. And it's, what is it? It's snail. What is it? It's snail.
There's somewhere in there that says something about a snail serum.
Yes.
I never saw that. I saw like the more medical stuff about it.
No,
but
I
it's
saw
a
that
potent growth
exactly.
factor.
Yeah,
And I
it
know
comes
it's
out
a
of
potent,
snails.
it's a potent growth factor.
Okay, we'll have to link
but
it at
it's
the
a
end
glazed
and it's
donut.
not that expensive.
No, it comes in ampules. There's also a whole
Yeah.
skincare lines. The company sent me some stuff to
Did
try.
you try their skincare?
I tried some bits and pieces of it. Yeah,
and?
it just kind of extends from what those little ampules.
Okay.
I feel like if I say too much, I don't want to confuse people.
Yep.
But I feel like it's a whole other conversation we can have.
So the ampules, is that what you call them?
Yeah. So you apply them for 10 days straight.
Yeah. They're like these little vials. You crack them open.
Yes.
It's kind of aesthetically satisfying. You crack it open and then it's just like this kind of
it really does
glaze.
Make the skin healthier, stronger. I use them even with my microneedling or Morpheus
Do you
treatments.
do like 10 days in a row and then you take a break?
Wow.
Or no, you just keep doing it?
No. Well, I do. Yeah. Like I do the 10 days in a row. If patients were getting this in office, I would include it in with their treatments.
Okay.
And then they would continue it on. We don't sell it at the office currently.
Right.
They can just get it online. I do have some in my room that I'll start them on. But I normally tell them to go ahead and
do you do it morning or nighttime?
I do it in the morning.
Okay.
And I still do it with my ZO skincare and I put it after complexion pads.
Okay.
So, and it's the only growth factor I'm using currently.
Oh, okay. So that replaces an actual growth factor.
I think it's more potent. Absolutely. Wow. I can see it in my skin. I can see it in my patient's skin. I'm literally
ordering some when we I just said when we hang
and then
out, when we finish.
The instructions do say too, and the company suggests that you just do 1 ampule a week after do
the
your
first
series.
10. That's right. Okay. I remember reading that.
Yeah.
Okay. I have to get that.
That's such a popular question. And I'm going to reach out to the company to make sure that I am saying everything and not sounding ignorant. Yeah. So yes.
Well, no, I think it's, and I
found it from a cosmetic dermatologist. I found it from her mentioning it. Okay. Because I was looking at her skin. Yeah. And then she mentioned it and did all this education on it. Yeah. So then I ordered it to try it and to figure it out before I talked about it. Yes. And then, but the company has been so amazing to give all of the information and to educate on.
I need more. Yeah.
Yeah.
Okay. Perfect. Well, I have loved having you here. And I know we kind of went through a ton of information, but people can go back, write down, pick from it what they need. Yes. And the Nashville Beauty Girl is where they can find you on Instagram.
Yes, Instagram.
And if they live in Nashville, they can, I know you have a bit of a wait list. What's your wait list right now? It's a few months out.
It's a few months out. It's a few months out.
Yeah. But you can get on a wait list. And I keep saying to people, it's worth the wait. Like, you haven't been doing anything up till now. Go where you're going now and then then get in. So
I'll usually can figure something out. So yes.
Good. Well, I appreciate you and I appreciate your
thanks
time.
For having me.
And maybe we'll have you back if we get a slew of questions or you come up with any more new tricks.
Absolutely. I'll see you in the office.
Thanks, Keri.